Entering the 21st century, medicine's enemy has become more cunning. It is no longer a tangible organ, but an intangible number, a risk lurking in the future. We are no longer content with treating diseases that have already occurred. Instead, we seek to扼杀them before they even emerge. Before the 1990s, osteoporosis was merely a risk factor for fractures in the elderly. But with the popularization of bone density scanners and the advent of related drugs, a precise numerical standard was established. A bone density 2.5 standard deviations below the peak of young adults was defined as osteoporosis. Overnight, tens of thousands of healthy, middle-aged, and elderly women worldwide were labeled as pre-patients, simply because of a single number. They were advised to take medication to prevent a fracture that might never occur in their entire lives. Ironically, some of these preventive drugs themselves could cause osteonecrosis of the jaw or atypical femoral fractures. Soon, blood glucose and blood lipids were added to this list of risks. The concept of prediabetes has classified more than one-third of adults as part of the high-risk group. The target threshold for cholesterol in guidelines has been lowered repeatedly, resulting in tens of millions of people who were originally healthy being advised to take statins for life. Later, we developed more powerful screening technologies, only to find that the human body is filled with countless insignificant dust particles. High-resolution CT and MRI, while searching for known lesions, always incidentally detect a host of incidental amounts, such as small lung nodules and tiny adrenal cysts. These shadows, which are mostly harmless, have triggered immense anxiety in patients, and a series of unnecessary needle biopsies, and even surgeries. In South Korea, the rise of thyroid ultrasound screening in the early 21st century caused the incidence of thyroid cancer in the country to surge 15-fold over more than a decade, yet the mortality rate remained unchanged. Studies revealed that among the tens of thousands of newly diagnosed cases during this period, most were the result of overdiagnosis. Pseudocancers that never needed to be detected. Countless patients thus underwent unnecessary surgeries, and even had to take medication for life. When medicine turned its gaze to the human brain, this wave of over-medicalization reached its peak. In the face of Alzheimer's disease, the US FDA, amid great controversy in 2021, granted accelerated approval to the new drug aducanumab. Clinically, it did clear beta-amyloid plaques, visible in imaging scan, but it failed to prove that it could significantly improve patients' memory or quality of life. Meanwhile, up to 35% of patients experienced severe side effects such as cerebral edema. The FDA's independent advisory committee voted 101 to strongly oppose its approval. 3 committee members even resigned in protest.